I don't think that man went to medical school. This woman had an extensive treatment with a plasma pen. A plasma pen is this little handheld device that will essentially create tiny burns in your skin. It's being used in spas and even at homes all across the country because people can actually go online and buy these plasma pens and literally burn tiny holes in their skin. So the belief is that if you burn these tiny holes, eventually they heal and your skin gets tighter. It is kind of similar to what we do with lasers, but the problem with the plasma pen is that number one, there's no real way to prevent that burn from going too deep and creating scarring. And number two, there are people who are completely untrained who are doing this not only to themselves, but to other people. So please, please, please stay away from the plasma pen. Why would somebody put these snails on their face, and what benefit can you get from it? Well, the slime that is produced by these snails that they leave behind when they kind of crawl across your face actually is filled with antioxidants, with powerful moisturizers, and with even anti-inflammatory fats. But you don't have to have a snail on your face to get it. There are commercially available snail slime creams that you can get. It's super popular out in South Korea, and I'll even put a link to one of them in the caption below so you don't have to get a live snail and put it on your face.
Okay, y'all, second time applying the butt paste to my face, and this time very different because I'm applying it after a bunch of skincare.
So this is a new TikTok trend where you take butt paste, yes, the paste that you put on your baby's butt, and you apply it to your skin. And this was actually started by a dermatologist, Dr. Shireen Idris, and the idea is that butt paste contains zinc oxide. Yes, the same zinc oxide that we use in sunblocks, you can put that in butt paste and then you put it on your face, and the idea is that it is anti-inflammatory and helps to seal in moisture. Now this is in general recommended for people who have really dry skin, and the term being used for this type of treatment is skin basting. So in general, I feel that this is a very reasonable thing to do if you've got really dry skin, but if you've got oily and acne-prone skin, I wouldn't necessarily recommend skin basting for you.
My husband and I have removed the bottoms of all of our shoes. We decided to start walking barefoot, and one of our followers had a great idea. Since some businesses don't want us being completely barefoot, if we cut off the bottom of our shoes, it'll allow us to be barefoot but blend in with everyone else. This is a huge commitment, but we were willing to make it. These are our favorite shoes. Our shoe collection is worth more than $20,000, but this is a sacrifice we're willing to take because walking barefoot means the world to us. The benefits of walking barefoot are priceless, so now our shoes are worth more than money could ever be. The experience of cutting off the bottoms of our shoes was very freeing and detoxifying, just like walking barefoot is. I definitely recommend this if you're trying to go incognito barefoot. It's the perfect way to get all the benefits of going barefoot, but also have no one know.
What has happened to society? I mean, literally a piece of glass on the ground, doggy doo, somebody's vomit or urine, like that's the end of your day. Could you imagine? This makes no sense. Like, why? Now there is a belief called earthing or grounding, that if you put your feet on sandy ground, on like the soil, that you can actually absorb the negative electrons that come from the soil, and it can actually be potentially beneficial for your health. That is still arguable, and it is something that a lot of holistic health practitioners do encourage, and I think in general it's overall a good thing. You know, getting your feet into some grass and some regular, dirt is not a bad thing. But these people are walking around in the middle of a city street on the sidewalk. You're not earthing by walking on a concrete sidewalk. I mean, I guess Darwin in action?
ไม่เยอะค่ะตื่นเต้นเพราะว่าเชื่อฝีมือคุณหมอว่า
โอ้โหเดี๋ยวขอรีดตรงนี้ออกนะนี่เป็นจุดพอยต์เลยสำหรับคนที่อยากจะออกมีความดันโลหิตสูงอยู่ที่ประมาณ150 ถึง 170 มิลลิเมตรประหลอด2ตัวบนนะครับตลอดเวลาแต่ว่าคนไข้ใจสู้นะครับแล้วก็หมอตะวันก็มีเทคนิคในการทำให้ซึ่งคนทั่วไปเนี่ยจะไม่เข้าใจในช่วงแรกไม่ต้องกังวลนะครับเพราะว่ามันอาจจะมีการตึงแบบนี้แล้วก็มีการชี้ขึ้นบ้าง
What the hell happened to her? So this is called black swan eyes surgery, and they're doing a combination of a blepharoplasty where we remove excess skin from the upper eyelid with a eyebrow forehead lift where you remove skin from above the eyebrow and elevate the eyebrow that way. And then she probably also had a canthopexy where you take the corner of the eye, you detach it from the bone, and then you reattach it into a higher position. She can't even close her eyes afterwards. There is so much just overdone plastic surgery being performed in Asia that it just astounds me. I really feel for the women because most of these patients are women who are going through these extreme operations that they feel that they need to. I mean, this is a beautiful woman before, and if she wants to get a little tweak here and there, that's great, but man, this is a lot. All right, what is worse than the plasma pen? Well, the Hyaluron pen. So the Hyaluron pen basically is a device that you can freaking buy at Walmart that uses pressurized air to push substances through your skin. So what they're doing here is they're using this Hyaluron pen to push injectable filler into these women's lips. The problem with this procedure, number one, you don't have really control over how deep it goes. So you can get terribly lumpy results afterwards. And much, much worse, number two, is that if you push that filler into the labial artery, you can clog that labial artery and you can literally kill off parts of the lip. Do not use a Hyaluron pen. If you want to get your lips injected, have it done by a professional who does it with an actual needle or a cannula where you have very, very good control over where that filler goes. The Hyaluron pen does not allow you to do that, and I mean, doing this in some type of a spa or salon, just not healthy. Please don't do it.
Now I want you to look at the difference between their upper arm and their lower arm. Can you figure out what's going on here? This patient is in their 80s, and they wore t-shirts all the time, but they never wore sunscreen. And for over 40 years, they were an avid golfer who lived in Hawaii, California, and now Colorado. I find it amazing the difference. He has almost like baby skin on his upper arm, but you can see all the sun damage on the lower arm here.
That is really impressive. I mean, it's great that this gentleman wore shirts because you can see how his skin was protected in those other areas. Now, it just shows the absolute importance of sun protection. When you've got skin like this gentleman has on his lower arm, on his forearm, and his hand, there's a very high risk of skin cancer, and some skin cancers can actually be deadly, like melanoma. One of my favorite musical artists of all time, Jimmy Buffett, recently died from a type of skin cancer. So please, 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 if you're going to be out, wear your sunscreen, at least SPF 30, and then reapply it every 2 hours.
Adriele, É nóis, Adriele, com o homem mais tatuado do Brasil, hein?
I'm frightened. Wow, I have seen a lot of body mods in my life, but this guy really does take the cake. He's scary looking. Now, I've met a lot of people who've had body mods, and they're typically the nicest, kindest people, but he's scary. This young woman had a melanoma removed from her scalp, I think maybe the top of her head. As you can see, she's had reconstruction. This is one of the things I love, honestly, about being a plastic surgeon. So, beautiful young woman, had a melanoma on the top of her head, had that excised, and maybe, and I'm not her doctor, but it looks like maybe they put a skin graft over it. And then those two things that protrude out from her head are tissue expanders. Tissue expanders are basically balloons that we fill up with saline solution, and we gradually use them to expand, let's say, the scalp to basically create more skin. The idea then is that when there's enough skin created, you can cut out that skin graft, shift the tissues over, and try to recreate a natural hairline. And as you can see in this video, her plastic surgeons did an amazing job because her hairline looks absolutely fantastic. Now, she's been very vocal on social media encouraging people to use sun protection because the number one thing that you can do to prevent yourself from getting a melanoma like hers, which is very, very dangerous, is to stay out of the sun, and if you are in the sun, to use a good sunscreen. It's just a beautiful result on a beautiful woman. Now, every time I do a TikTok reaction, I try to throw in one of my own TikTok videos that's been very popular. So take a peek at this one and let's see what you think. I have an appointment with Dr. Youn.
Why don't I bring you back right now?
Actually, no. I'd rather just stay here right now. It's got such a nice view.
Okay. Oh, are you a patient here?
Oh yeah, Dr. Youn is the best.
Oh, really?
Ricky, let me bring you back. Oh, I'm so excited. It's filler time, Megan. So what can I do for you, Ricky? I need some filler. No, I mean, I'm sorry, Ricky, but every 6 months you come in here and you ask me for filler, and every 6 months I tell you no. So I should go see Dr. Dubio instead? I think so. So this is actually kind of a true story. Many years ago, I had a patient who had way too much work done, and he would keep coming back to my office every 6 months wanting more done. And I've actually never treated this patient before, but he just kind of liked me. So every 6 months, he would make an appointment, he would come in, I would say, I'm sorry, but I'm not gonna do anything except potentially melt this filler away. And then he'd say, well, then I'm just gonna go to Dr. So-and-so down the street. And I'll say, you know, that's your option, but I would really encourage you, you don't need more, save your money. And he wouldn't listen to me.
I just want to stay in the game, Danny.
So this is something that happens in plastic surgeons' offices all across the country. Sometimes people don't take our advice, and that's okay, but I still try to give that advice anyway because I always am honest with my patients and try to do whatever is best for them. Well, these are some unhinged TikToks, but they're all